Now we spoke about hydrocephalus, but we didn't actually talk about possible treatment options you might actually want to employ for hydrocephalus. You understand? So hydrocephalus is more of like there's a whole lot of accumulation of what? Cerebrospinal fluid in the ventricles. Do you understand? So there's a way you might actually want to do a surgery. Tap from here, drain it down to the peritoneal cavity. Okay, so this is simply what's known as CSF drainage, okay, using shunts or catheters. So what we have here is this. It's just a critical intervention for conditions like hydrocephalus. Mostly you want to drain this if the cerebrospinal fluid levels in the brain, that's the ventricles, is too much. You understand? So two primary methods used is shunt systems and external ventricular drains. Okay, so here's a breakdown of both. Now let's talk about shunt systems. This is shunt. So they are surgically implanted devices. Now they redirect the fluid from the ventricles, that's the cerebrospinal fluid from the ventricles, right down to another part of the body. Most at times we use what? The abdominal cavity. Okay, so how shunt works: a proximal catheter collects cerebrospinal fluid from the brain ventricles. A valve regulates flow to prevent over or under drainage. Okay, so distal catheter carries fluid to a drainage site like the abdomen or the heart. Mostly we use the abdomen. Okay, mostly abdomen. So types of shunt, is the ventricular peritoneal shunt. So the thing is, you have what? The shunt here. Now from here is the catheter continuing down. Do you understand? So via shunt or catheter, or is via shunt and catheter. Do you understand? So we have the ventricular peritoneal shunt used in treatment of hydrocephalus. Okay, we have the ventricular arterial shunt. Okay, diverts into the heart right atrium. It's red. Or then ventricular pleural shunt. This one is into the pleural space of the chest. We'll find time and talk about this special, shunts. Let me even snap it. Okay, we'll find time and discuss it further. Okay, so that's it for CSF drainage via these two methods.